can you deal with the questions that have been raised, and as many of the written ones as you can, please,
okay.
or your colleagues?
Thank you for all the questions. They're all very good questions. In most cases, they're things we've thought about and tried to grapple with. And as one of the speakers said, none of these things are straightforward and easy. Before we get into them, therefore, I would like to reiterate that we didn't get this right in raising it with you before. We now want to get that right, so I want to propose that we will have many sessions in the organisation where people on this side of the table will sit down with groups or individuals and work our way through them with you, giving us best explanations as we can. Because I reiterate, we too use these services, we too value them, and it may be easy to dismiss those comments, but we do believe in this organisation. We want to build a stronger, better future with you and for you. Let me respond to one of the very specific questions from the floor about democracy. We have a shadow council of governors, 15 or so people elected by members in a foundation trust status. We are obliged to have governors elected by the community, and we would be doing that.
Nobody sent me my form and I asked for one.
I'd like now to give my colleagues...
No, one at a time, please. Joe, go on.
I'd like to invite my colleagues to comment on some of the themes and issues, because it would be difficult, I think, in the time available to cover them all in detail. I'd like to start with Dr. Greg Battle, too, on my right here, who's a local GP who gives his time to the board to help us make sure that the plans that we're putting forward make sense, that they fit with what GPs want, that they can be funded by the local GP commissioning groups. So I think he will have a number of interesting things to say to you.
I'll see you in 5 weeks.
Well, at the good English practice in Holloway, we can do better than that.
Good.
Let me know your practice, and we can talk about that afterwards. I'm a local GP and have been working in Holloway for 20 years, and I'm really, really passionate about the NHS. I've dedicated my life to the NHS, and I intend to spend the rest of my career in the NHS. I also am really passionate about the Whittington. I refer to all the local hospitals and have done over the last 20 years. And there are people abroad in London who think the only solution for NHS in London is very large hospitals. And my experience is, in fact, that smaller hospitals are more humane, more open, kinder and more compassionate. And my experience of referring to local hospitals for 20 years is that that's the case at the Whittington. So I've been working at the Whittington for a year and a half, part-time, while I still continue to see 100 patients a week in my practice and still refer to the local hospitals. And I really think that the plans that we've got are critical to, in fact, keeping the full range of services on our site and in the community. And that the direction of travel is, quite rightly, to more care at home. My patients tell me often they do not want to be admitted to hospitals. Hospitals are not seen as a safe place as they used to be. So if you can get out of hospital quicker and the community services are there to look after you, in my experience, that's better for patients. It's a good point to say, is there capacity in the community? And there isn't enough capacity in the community. And we as GPs are absolutely determined that this work is not coming our way without resources, without the right skills in the community, and without the nurses in the community. And I'm on the board and working closely with our GPs to make sure that that doesn't happen.
Thank you, Greg. I think I'd like to ask Anita on the end here to address some of the maternity issues. If you've ever been to the Whittington, you'll see that in the block where we do maternity, on the lower ground floor, we have a fantastic midwife-driven led birthing unit, where women need more attention than to be given by a midwife. The rest of the accommodation is pretty awful. We really want to improve that. We intend to spend £10 million, which is a big part of what we might get from proceeds from other buildings. We intend to invest that in maternity because you need it and we want to provide it. I'd like to ask Anita to talk perhaps more broadly about those issues.
Yeah, I'm a non-exec at the Whittington, and I had 4 children under the care of the team at the Whittington. I had my children at home, and the youngest of them was born with pneumonia and was very, very ill, and he was blue lighted by the midwife into the Whittington. And like that lady who asked the question and her very, very brave son, I understand absolutely how important it is to have that local care, but also I chose the Whittington, as so many women did, for exactly the reasons that Greg talked about. The humaneness and the quality of the service at the Whittington. So maternity services at the Whittington are exceptionally safe, and we have kind, caring, compassionate staff who are focused on meeting women's needs. But they do that out of a building which is not what you would want for women this decade. In fact, it's not what you would have wanted 30 years ago. We have tried really hard over a number of years to find money to invest in the building. So we want to sell some of this land in order to bring the facilities up to date. That will enable us safely to deliver around 4,000, at least 4,000 births a year. Now, 4,000 births a year is around what we do at the moment. I think we did 3,900 and something. Women had their babies last year. We know we can definitely deliver that number of women safely. Delivering babies safely is our #1 priority. So by investing £10 million, women can be delivered safely in a facility that is that meets modern standards, that gives them the sort of care that they would want. So there's no cut to maternity services. I want to say that over and over again. There is no cut to maternity services.
Okay, thank you.
If you've got anyone...
I think finally, I think we're at the end of questions, aren't we?